The healthcare landscape is ever-changing. To meet the evolving needs of our population and overcome new challenges, Singapore's healthcare system must innovate to deliver sustainable healthcare and better value for our population.
We know from international research that up to 35% of patients admitted to hospital don't strictly need to be there at all. They may need daily clinical review, tests or treatment, but don't need to be occupying a hospital bed overnight.
The problems faced with this classical way of evaluating a patient is that it involves admitting the patient and using precious inpatient hospital resources. We wanted to see whether we could deliver the equivalent of inpatient care as an outpatient setting. This model has been successful in the UK, but has never been tried in Singapore. The key outcomes of our project are that we saved on admission for the patient and saved inpatient beds for people with higher acuity, thus allowing the patient to spend quality time with family, and all without compromising patient safety.
Survival of patients with cardiac arrest is time sensitive. Treating patients within the golden 5 minutes lowers the risk of brain damage and improves their chances of recovery. We took the opportunity to improve our Code Blue response to less than 5 minutes within 6 months.
We took a deep dive into multiple areas to revamp our Code Blue response model. Key changes include the development of interprofessional Code Blue teams, and they are now organized by location to achieve a faster response.
We not only achieved our initial goal, we also achieved more successful resuscitations, above that in the UK and US. This revamped Code Blue model has been implemented throughout SGH and will be expanded to new buildings on the campus.
At the onset of the COVID-19 pandemic, NHGP's senior management team envisioned telehealth services for patients to continue receiving care while minimizing the need to travel between their home and the polyclinic. We used predictive analytics to support identification of eligible patients, reducing the number of doctors required to screen medical records. And we enhanced the IT registration system to reduce teleconsultation actualization from 60 to just 5 minutes. As of November 2020, about 140,000 sessions have been conducted. Many patients reported that they had a good or excellent experience. An evaluation of chronic disease outcomes showed that teleconsultations were not inferior to in-person consultations and may even be more effective in empowering patients.
During the COVID pandemic, there was a surge in demand in chest x-rays performed, and this resulted in a strain in the manpower, for which we needed a solution quickly. This project uses machine learning and computer vision to analyze the chest x-rays performed in a consistent and reproducible manner, allowing for timely reporting of these chest x-rays.
Prioritizing the abnormal films on the worklist allowed us to shorten the turnaround time for the reporting of those films by 20%, and maintaining the diagnostic accuracy of the model at 96% allowed us to increase the diagnostic confidence of our reporting radiologists.
Exercise therapy as part of cardiac rehabilitation after an acute myocardial infarction is essential and important. However, more than 90% of patients miss this crucial part of rehabilitation, as many of them need to return to work or other duties. Hence, there was a need to develop a strategy to empower patients to exercise safely and effectively beyond clinic walls.
HeartTrack consists of a wearable heart rate device which syncs to a mobile application to deliver personalized cardiac rehab exercise therapy. This data is uploaded to a remote portal which clinicians can access for monitoring. HeartTrack proved to be convenient and easily accessible to patients who could now participate in personalized exercise therapy anytime, anywhere. It also allows clinicians to deliver personalized medicine remotely and support them in their heart health journey.
Classroom-based Lean training has been slow in outreach and was disrupted during COVID-19. There was a need to continuously upskill our ground trainers to meet their job aspiration and the need of the organizations.
We insisted on strong andragogy design despite the digital medium, ensuring that the e-learning was not only convenient but effective. With the learning taking place online, we took advantage of the reduced manpower resources to continually review the curriculum to meet the changing needs of the organization and prepare our trainers to take on the coaching role. Many of our staff reported that the e-learning modules facilitated good understanding of the content, and the productivity savings have been very significant. Consequently, our module will soon be offered beyond TTSH to other central health partners.
Previously, our home care programs were operating in silos, and the care of the seniors was fragmented. Our staff were also trained in only one service, which was not a productive use of manpower. We therefore wanted to improve our home care service by enhancing staff capabilities.
This project required a substantial revision of our management processes. Firstly, we maximized the synergy between services by cross-training staff across different programs. We also implemented technologies like body cameras to enable safety surveillance and staff training. Lastly, we introduced e-forms and digital databases and began using business intelligence software to drive more productive care solutions.
Now, more than 80% of our total manpower are trained in 2 or more services, and the usage of business intelligence improved our productivity. As a result, our surveys reported a significant increase in client satisfaction.
I believe we achieve success because our people embrace new ideas and technologies and welcome opportunities to enhance systems and structure in order to improve our clients' experience.
Digital transformation is an arduous but fulfilling journey. Resilience is the key to persevere through the highs and lows of the journey.
To succeed, you need to build a shared purpose, understand and solve operational issues, and leverage on existing networks of collaboration.
Develop a strong partnership between the clinician and the scientist to identify the clinical problem so that we can develop a solution that can be deployed readily in clinical practice.
A deep sense of team ownership was crucial. Without the collaborative spirit of everyone involved, we would not have developed a framework that is effective and efficient in such a short amount of time.
You don't have to reinvent the wheel. Take inspiration from successes around the world and adapt them for your own context.
There's no idea that is not good enough. Start small, test, and refine it along the way. The end result may surprise you.
Innovation is always an ongoing process of redesigning. It will be a tough challenge, but extremely rewarding when you see the results.